a couple of slides left. The first one being unacknowledged registrations. If you could just explain what that is, please, Ellie.
Yeah, so these registrations are submitted by your GP practice that have not been processed by PCSE. So there are a few reasons why these registrations have been unacknowledged. Firstly, PCSE didn't receive the registration, and it could be due to the interchange management issues previously discussed. Secondly, we could reject the registration if not been actioned or resubmitted. But thirdly, we have received and processed the registration, but there was an issue processing the approval message on your clinical system. So again, an interchange management issue, and support would likely be needed by your system supplier for those. So most registrations are processed within 30 minutes to about 70% of those. Then PCSE aim to process the remaining 3 working days. Although it is a data quality issue with the registration, it could take 10 days. If you do have an unacknowledged still sitting there after 10 days, please contact us via the pcsc.registration Preston email, and with your patient details and the practice code, we can trace the registration and we advise how to resolve those. Transaction or interchange numbers would also help us to identify those.
Thanks, Ellie.
Unmatched transactions. So these are transactions sent by the spine to your clinical system, but they couldn't be matched with a patient or a corresponding transaction on your clinical system. So, for example, unmatched transaction is when PCSE have sent an acceptance for registration, but the patient's already registered on and active on your clinical system. So an unmatched transaction is created. If you do have an unmatched, please contact us through PCSE Registrations Preston and with your practice code and transaction number, and we'll provide the patient details and any steps or guidance that might need to help resolve that. You need to be checking your unmatched transactions regularly for a few reasons. Firstly, it can indicate a more serious issue that we might not be aware of, and we need to resolve it as soon as possible. But also, PCSE system only holds those for a couple of months. So the sooner that you do it, the more information we can provide to help resolve those.
Right, and so if you could let us know what high security and security control procedures are, please.
So high security is a function that updates the practice clinical system, but doesn't send a message through the GP links to update the spine. So you'll update your system, but not ours or the spine. So when the spine hasn't been updated, it will cause a misalignment between the systems. And of course, you get paid through the global sum payments, which uses the spine. And it could mean that you also miss other practice targets. So this function should only be used if instructed by PCSE. And it is only if it's to correct a discrepancy that we've made you aware of, and we can ensure that both systems are aligned at that point.
Lovely. So what about patients deducted as deceased in error?
So if a patient is deducted in as deceased in error, please don't register the patient immediately again. It will just cause an issue. The transaction may have been processed, that flag that they are deceased has already been added to the spine. So what you need to do is contact PCSE via email, providing your practice code and the details of that patient. We'll then log a case with the National Back Office or MBO to remove that death status and reflect in any of those death status updates or anything that's related to that death on the demographic data. Once we've confirmed that it's been removed and the ticket's been resolved by MBO, we'll then advise you that you can then re-register that patient.